Great afternoon to everyone tuning in today. My name is Jen Distance. I am the president of the Cultured Pearl Foundation, Inc. Our organization provides charitable and educational outreach in the Stamford and Norwalk communities. Each year, we provide numerous scholarships to local high school seniors to assist them in attending college. Our students have gone on to attend excellent schools around the country, including many HBCUs and Ivy Leagues. We also provide emergency relief to the community. This year, we have been particularly busy, providing relief from COVID-19 related emergencies, combating food insecurity, supporting small businesses, and preventing homelessness. Our organization consistently provides educational opportunities that strengthen and propel our communities. With that in mind, we created a new forum called Armchair Chats. An armchair chat is a place where you can curl up and speak frankly about the subjects that matter most. Just as you would curl up with a best friend in their living room, we aspire to create a non-judgment zone where you can speak frankly and get the truth. So welcome to the first armchair chat. We chose the topic of COVID-19 vaccine because there's just so much unfamiliarity to the public. People have very strong opinions, and many people, particularly those within the African diaspora, Latinx, and indigenous communities, harbor an understandable distrust of vaccines. We hope that you will find an open forum here and receive pertinent information. This forum would not have been possible without the tireless efforts of our board members who have provided endless hours to bring this to fruition. I would like to give a very special thank you to the committee that championed this effort: Valerie Adams Baker, Conchita Tucker, Kirsten Harris, Jasmine Shockness, and Lisa Bennett. I must give an incredibly special thank you to the Foundation's Vice President, Dr. Tanya Clemens. Dr. Clemens realized early on how much confusion there was in the community surrounding the vaccine. She promptly encouraged our board to champion an effort to engage and educate. As a former executive at Pfizer, she gave her time and her expertise. She leveraged her contacts and allowed us access to the very brilliant team of panelists that we will hear from today. I would also like to thank the team at Pfizer and our brilliant panelists who have been giving in every single way. We just cannot express enough our gratitude for their participation. So without further delay, let's get to it. I'm extremely privileged to introduce our moderator today. We are so thankful to have the icon, Gwen Taylor Edwards, with us today. And Ms. Edwards jumped right on board without any hesitation, and we are just so thankful to have her. Gwen Taylor Edwards is a broadcast journalist with more than 25 years of experience. She is an award-winning producer and host of Our Lives for News 12 Connecticut. This segment celebrates diversity in Western Connecticut and can be seen during the weekend newscast. Among her many honors, Gwen Edwards has received 2 Emmy nominations and 3 Gracie Allen Awards for Best Talk Show. Ms. Edwards was named by the Connecticut State Conference of NAACP branches as the 100 most influential Blacks in the state of Connecticut. Additionally, she has received the McDonald's Black Media Legends Award and the Connecticut Hall of Fame's Best Community Talk Show of the Year Award. Gwen Edwards is also a proud honorary lifetime member of the Urban League of Southern Connecticut. She is the chair of the Deaconess Ministry at Union Baptist Church in Stamford, Connecticut. Gwen is married with grown sons and 5 grandsons. And I'll tell you, Gwen, when I saw that, I said, she's a glam ma. There's no way anyone would know that as beautiful and glamorous as you are. But on top of being beautiful, you are extremely intelligent and talented. And we are again thankful to have you today.
Well, ladies, AKA, thank you so much for asking me. And this topic I feel strongly about because as we know, our community has been hard hit. We've lost too many good people, and it's time for us to educate ourselves, to take advantage of the medical breakthroughs that have occurred with the vaccine, and to get the needles in the arms of as many Black and Brown people as possible. So thank you for sponsoring this Armchair Chat on such an important topic. Thank you.
Thank you again. And I'd like to encourage everyone who's watching today to stop and share this immediately with your Facebook friends so everyone can get some great knowledge. Thank you again.
Thank you. At this time, we're going to meet our panelists. And these are exceptional ladies. First off, Susan Silberman, who is a global advisor for Pfizer Pharmaceutical. And Susan, tell us a little bit about yourself. But first, let's introduce our second panelist, Dara Richardson Heron. And she is, as she says, a physician by trade, but an advocate, a patient advocate by choice. And her title with Pfizer is Chief Patient Officer. So Susan, tell us a little bit about yourself.
So thank you, Gwen, and thank you everybody at AKA for inviting us today to talk about indeed a very important topic. As Gwen said, my name is Susan Silberman. I have the dubious title of Global Advisor, but that's because I'm coming to the end of a 3-decade career at Pfizer. And for the last 3 months, I've been mainly focused on the COVID-19 vaccine. My past history has been a lot around vaccines. I ran our vaccines organization for about 6 years, and more recently, I ran our pharmaceutical business in emerging markets. And that's really how this all got started. What I really think is important about this to remember is a year ago, most of us had no idea what COVID-19 was. We knew if we read the international pages of the paper that there was a strange virus circulating in Wuhan, China, that it seemed to be pretty contagious, and that the World Health Organization was starting to get just a bit concerned. About a year and a month ago, I was just coming back from China, where I had been to visit my colleagues for a regular business meeting, and the information about the virus was just starting. By the time I got home, I was asked by senior leadership at Pfizer to put together a small group of people to help our colleagues in China, about 10,000 in total, get through this virus, because it was looking like it was going to create some real havoc for our business processes. Fast forward more than a year later, that little task force that was focused on China quickly became a global task force focused on 100,000 colleagues, their safety and their well-being, focused on the robustness of our supply chain, and focused on making sure that we were able to do our jobs and meet the needs of patients, of partners, of governments, and certainly of our colleagues, while working almost entirely, 100,000 people, remotely, except for the people that we had to keep safe so that they could go to our manufacturing sites and our R&D labs to begin what became the partnership that I'll talk a little bit about with BioNTech. That is a company that we started working with when I was running our vaccines business, because they had this novel platform called mRNA. I'll give you a little bit of the layman's view of mRNA, and then Derek can give you a lot more detail from the physician's perspective. But we knew the platform had some unique qualities, and we've been working with them for a number of years to develop a very robust flu vaccine. As we all know, flu vaccines have left us all wanting over the years, not being as effective as we'd like them to be. But what we did with BioNTech is they called our head of research at vaccines and said, hey, we've sequenced the COVID-19, the coronavirus. We think we could make a vaccine for it. Would you like to partner with us? She picked up the phone and called me, because I was the head of the task force. She says, do you think we could use a vaccine for this? Do you think it would work? And I said, well, you're going to tell me if it works, but I'm going to tell you that it looks to me like the world's going to need this. So let's do it. And that began the negotiations that started this partnership, this renewed the partnership beyond flu. And we began only in May. So we're not talking very long ago, with the selection of candidates that we went through testing. I'm going to look at my notes. I think we had 4 candidates to look at all simultaneously. We narrowed it down in late July to one of the candidates that looked most promising in terms of a balance of safety, but also importantly, efficacy. And then on December 11th, fast forward, after 44,000 subjects enrolled in the trials, we were able to get an emergency use authorization in the United States. We got it soon thereafter in Europe. We got an emergency use listing at the end of the year from the World Health Organization, which has allowed us to strike agreements with governments all around the world, both high, middle, and low income, to provide this vaccine to literally to millions of people. Now, in terms of how we do this, the manufacturing of an mRNA vaccine is complex. All vaccines are complex because you have to make sure they're exquisitely sterile. So one of the things that we did is we partnered very early on with a number of outside contractors to provide us some of the raw materials that we needed. And we concentrated the majority of our efforts in 2 locations. One in Kalamazoo, Michigan, which if any of you saw President Biden yesterday, he spoke from our manufacturing site yesterday. And that's where the US supply comes out of our Kalamazoo site. The rest of the world comes out of our vaccine site in Poers, Belgium, which is right outside of Antwerp. And we basically retooled half of these manufacturing sites just to focus on our vaccines so that we could follow all of our normal good clinical practice and all of our normal good manufacturing practice to make sure that every dose was as safe as the next one. So whether you're getting diagnosed or you're getting your vaccination in Indiana or whether you're getting it in India, the quality of the dose and the safety of each dose is exactly the same. The quality standards are exactly the same. So on December 13th, when our trucks left our manufacturing site in Michigan, many Pfizer colleagues were watching live CNN or CNBC or whatever channel was carrying it. And literally, as I wrote to our head of manufacturing, I have never cried when a truck left a manufacturing site. I literally had tears streaming down my face because we knew this was the beginning of being able to contribute to what we think is very important as a Pfizer colleague, which is breakthroughs that change patients' lives. And we believe that we can be an important part of changing the course of this pandemic. So
thank you so much.
You're very welcome.
Like a movie.
Yeah, a little bit.
It's beyond what is normal when it comes to testing vaccines, and it sounds like a movie, but you and Pfizer made it happen. Thank you.
You're very welcome. You're very welcome.
Dara, let's talk about patient advocacy and why it's so important when it comes to COVID.
Well, certainly I'm delighted to be here. And first, let me echo my thanks to Presidents Jen Distance and Lisa Bonet, AKA Omicron Epsilon Omega, and the Culture Pearl Foundation for inviting me to join today's event. And it's a pleasure to meet you, Gwen. As you mentioned in my introduction, I'm a physician by trade and an advocate by choice. And when you think about patient advocacy, throughout my 25+ year career, as a physician, I've really focused on finding ways to decrease the burden of disease and to connect with and be an advocate both with and for patients, particularly those who have been underserved by our nation's healthcare system. And so, now in my role as Pfizer's Chief Patient Officer, I have the opportunity and quite frankly, an immense responsibility to make patients and all patients our North Star and our focus and our partners in everything we do. Because, let's face it, in order to achieve health equity and ensure that the medicines, treatments, and the vaccines that we are talking about today benefit all patients and help us achieve the vision and our mission that Susan spoke about, breakthroughs that change patients' lives, we have to focus on the needs of and have direct input and participation from patients from all walks of life. And I think about the words of Dr. Martin Luther King, and I just want to give you one of his quotes, and it's, "Of all the forms of inequality, injustice in healthcare is the most shocking and the most inhumane." So, that's kind of where I sit as it relates to patient focus and patient centricity. And at Pfizer, when I think about patients, we've been aware from the very beginning that there's a huge responsibility on our shoulders as it relates to this virus that's not impacting all people equally. I mean, vulnerable and underserved communities, in particular, racial and ethnic minorities, are facing significantly increased risks of both contracting, suffering serious consequences of, and dying from COVID-19. But to combine that, and I think one of the reasons why we are all here today is that data is also showing that underserved populations and communities of color have some of the highest levels of mistrust. And, I think it's important to contextualize this mistrust.
And let's talk about that. What can you say today for those who just don't believe this vaccine is worth going to get, particularly those in the minority communities?
Well, first, I think I'd want to talk to those people to understand why they feel that way. But the first thing that I would tell them is that this is a matter of life and death. We are seeing people dying every day, multiple people dying of this vaccine, and many of them are Black and brown individuals. So I would say that it is so important. This vaccine is one of the brightest lights that we all have to help us get to the other side of this pandemic. So I would say, please talk to people who you trust. Please talk to your physicians, talk to your friends, your families, anyone you have to talk to get the information you need to help better understand the value proposition for taking the vaccine, I'm sorry. And I think before we judge people's hesitation, I think we have to, as I was beginning to say, we have to contextualize the mistrust, because many communities of color, unfortunately, have a well-earned mistrust of the nation's healthcare system, due in large part to historic transgressions where people of color were not treated with the respect. And in some cases, they were even harmed. I mean, we all know about the Tuskegee syphilis study. We know about the unauthorized use of Henrietta Lacks cancer cells. But we don't even have to speak in historical terms. Many communities of colors face barriers to accessing health services still today, irrespective of social economic status. And, we talk about microaggressions, but there have been macroaggressions. But I don't want people to get bogged down with that. I want people to understand that, we as a people cannot stand on the sidelines and allow the already unacceptable health disparities that we're facing in our community become even greater, because there is a vaccine out there that has been proven to be safe in diverse communities, because unlike many other drugs that many of us are taking, this vaccine has been tested in diverse communities and also among various different ages. And we want people to get the vaccine, because at the end of the day, vaccines alone don't save lives, vaccinations. And we want Black and brown communities to benefit just as all other communities.
Well, ladies, thank you. Couple questions to start off our roundtable armchair chat. Can you explain how the vaccine works? And Susan, I'll direct that to you.
So I'll start with my very simple explanation. A lot of people have asked this question, and I think to Dara's point, what's really important is to try and get answers that help you get over your hesitation. Because as Dara said, the one thing we know about this vaccine, and frankly, all the vaccines that have been approved so far, is they probably will keep you from dying. They will likely keep you out of the hospital. Two things that right now no one really wants to face. So the mRNA vaccine, the best way that I have come up to describe it to my many friends and family members and colleagues, community members that have asked me about it, is if any of you have seen a 3D printer, how do you work a 3D printer? You put a code in, and the code is the code to print a little toy truck, let's say, or to print a paperweight, or to print the part of a machine. I mean, we can even print, it seems, body parts these days. That's exactly what this vaccine is. What we do is, in that vial is a code. That code gets injected into your arm, and it tells your body to print out the antigen. Then your body does the miraculous things that all of our bodies have done since we were tiny babies. It sees a foreign invader, and it says, I've got to attack it. And your body does what it's paid to do, to mount an antibody defense. It creates all these different soldiers, if you will, to attack that foreign thing that has come into your system via the code of the vaccine. And it will stop it in its tracks. This is exactly how it works. We are not injecting you with a virus. We are not injecting you with an inactivated virus. Many things people have talked about from some of the mishaps from vaccines from 50, 60, 70 years ago. It's a code. It tells your body what to do, and then your body does it. It's amazing. And it's one of the most amazing pieces of science we've seen in probably a century. And we were all holding our breath, waiting to see the data that I'm sure Dara can explain better than I can. But the data that we see shows us that if you get vaccinated, you're not going to die from COVID, and you're not going to go to the hospital. Two things that I think are just the most important things to remember. Dara?
Yeah, no, Dara, I think you... Go ahead.
Okay, Dara, if you can hear me?
Yes, I can.
Okay, excellent. I was just saying, go right on. She had asked you to pick up the baton concerning how the vaccine works.
Yeah, no, I think Susan covered it very well. You know, it is an incredible technology that really, you know, teaches, you know, your body how to become a machine at protecting you from the coronavirus. And, you know, one of the things that I just want to pick up on that Susan said, it's really important. One of the myths that we hear a lot about is that, you know, if you get the vaccine, it's going to make you, you know, get the virus. And that is not the case. As Susan said, the vaccine does not contain any COVID-19 particles, so you actually can't get the virus from taking the vaccine. That's one of the myths out there. Another myth out there is that, you know, there's a microchip in the vaccine. And I know that might sound laughable to some people, but that's really out there on social media. And a lot of people use Dr. Google, which, you know, as a physician myself, I kind of bristle at that. I think it's so important in our communities to make sure that we are leveraging the trusted voices, you know, whether it's our physicians, the nurses, and other our faith-based leaders and others who have accurate, user-friendly information. But there is also no chip in the vaccine. There are questions about the vaccine and infertility. And at this time, we are not aware of any incidents of the vaccine causing infertility. But as to how it works, it essentially works by turning your own body into a machine to protect you against the virus. And it's remarkable in terms of effectiveness. The effectiveness has been demonstrated again in many diverse communities, and it's been proven to be about 93 to 95% effective. And that's, just to give it some perspective, that is far better than the flu shot, which is in the 60% effectiveness. It's far better than most vaccinations, and so we're very, very proud of that.
Dara, does this vaccination change or reprogram your DNA? Can it get into the membrane of the DNA?
Thank you for that question, Gwen, because that's yet another one of the myths that are out there. So the answer is no. mRNA is a carrier of information. That's exactly what it is. mRNA stands for messenger RNA. It's a carrier of information. It does not integrate into human DNA. And unlike a traditional vaccine that uses, some of them use what's called inactivated, dead, or portions of actual virus to create this immune response that we're talking about. But what mRNA does, it delivers a message to your body cells via, you know, a lipid particle envelope. And we don't need to get so text, and so deep here, but basically this message instructs the cells to generate the spike protein that's found on the surface of the coronavirus that initiates infection. And it doesn't get into the nucleus of your cells. It does not impact your DNA, nor does it change it.
Should people with immune system compromises, those who have compromised immune systems, get the vaccine?
Well, as with all, vaccines or medical treatments, people should speak to their doctor to get the best information that, takes into account their specific health condition. But I want to be clear that the Pfizer BioNTech COVID-19 vaccine is not a live vaccine. So it can actually be administered to immunocompromised patients in consultation, of course, with their healthcare providers. And so, some physicians and other providers may want to inform their immunocompromised patients of the possibility that there may be a diminishing of the response to the vaccine. But again, there is no absolute statement that people who are immunocompromised should not get the vaccine. This decision should be made in consultation with a person's physician based upon their unique health condition.
Are there certain populations or groups that are not recommended for the vaccine?
And again, I'm going to, I will always defer back to say that it's always important to consult your physician or healthcare provider. But in general, let me say that the Pfizer BioNTech vaccine is authorized for use only for adults who are 16 years of age and older. So right now, people under the age of 16 are not authorized to get it. And then also people who have had a severe allergic reaction to any ingredient in the vaccine should not take the vaccine. A list of the components can be found in the CDC website. And also people who have an allergic reaction to something called polyethylene glycol or polysorbate, which is closely related to polyethylene glycol, they should not get the vaccine. And then people who have had a severe allergic reaction, and when I say severe allergic reaction, I mean stopping breathing or any of that after the first dose of the vaccine. Certainly those people should speak to their doctor before even considering taking the second dose. But I urge people to go to the CDC website. There's a lot of information, but in particular, this is kind of nuanced. You should speak to your doctor about whether or not the vaccine is right for you if you've had a serious allergic reaction really to any vaccine.
And Susan, a person who is pregnant or wants to get pregnant, should they take the vaccine?
Again, Dara's the doctor here, but as far as I know, there's no contraindication at this point. There's no data to show that women that are seeking to get pregnant or women who are pregnant. In fact, there's a current recommendation because women who are pregnant are at such high risk for COVID that they should get vaccinated.
And I'll just add that our team is actually beginning a study on now on pregnant women and the vaccine. So Susan's absolutely right. There is no absolute contraindication to get the vaccine. But again, it depends on where you are in your pregnancy. And certainly that is a conversation that needs to be had with your physician. The truth of the matter is, I hesitate to say talk to your physician a lot about all of these things. But the truth of the matter is there's so much we still don't know about the vaccine. And it's better, again, to make these decisions in consultation with the person who knows most about you and your healthcare condition for some of these issues. Some of the issues we know the answer to right away.
Ladies, are you aware of anyone who have gotten both of their vaccine shots and yet still contracted COVID?
I personally know of only a few people that have completed their vaccine regimen. And of the people I know, I don't know anyone that's gotten COVID.
Yeah, and I don't know anyone personally, but I think it's important to know that, the vaccine study was designed to evaluate the vaccine safety and efficacy following the 2-dose schedule that we all know, which is the first shot and then the second shot followed by after 21 days. But data from the phase 3 study showed that although there's partial protection from the vaccine, as early as 12 days after the first dose, it's important to get the second dose. So I know you're hearing a lot in the news. Should I just get the first dose and not worry about the second dose? You should definitely get both doses. But it is possible for people to get the virus even though they've had 2 doses, depending on the timing of their exposure.
And for those who don't understand, explain how this could happen.
Well, it's because it's, say, for example, you get after your second dose, you are not fully immunized until about 7 to 14 days after the second dose. So if you're exposed the day after you get your second shot, there's a possibility that you could get the virus. But I think the good news here is that, it's very likely that since you've had the first dose and then the second dose, that even if you do contract the virus, it should be less severe. And that's what we're finding.
Are you compromising the vaccine if you do not get it in that time frame that's recommended? Because we're hearing about there are supply concerns, there are weather-related delays. So if you don't get it within a month or 6 weeks, are you compromising the vaccine?
Well, I think go ahead.
Go ahead. I'm pretty sure that we have a range within the clinical trials that goes up to well beyond the recommended 3 weeks. So if you had to wait because of a snowstorm or out of stock, it wouldn't be outside of the norm. Obviously, given the data we have, it would be preferable if you get it within the 21 day to 28 day window. But the other thing I wanted to say is that we've recently announced some changes to our manufacturing process that allow us to speed up the manufacturing of our vaccine. And so we hope that some of the supply issues that we have seen early on will go away. Now, just a reminder to everyone, Pfizer is responsible for the manufacture of the vaccine, and we ship it to a distribution point. Then we've been working with the US government, who is in charge of distributing it broadly across this country. And so some of the issues are not so much with how the supply has come out of the factories, it's been a disjointed distribution system. I think we've seen some improvements in that, and we've all heard that and read that in the news in the last few days, as well as, and I think Dara said this really well, we love to talk about vaccines, but what we really want to talk about is vaccinations. So what's really important is that the system in the country get better about vaccinations, about how many of us on this call today, on this chat today, have been trying to help family members and friends get appointments. How many of us have had multiple computers open to try and see if we could jockey between our iPad and our PC to get someone we care about an appointment that they don't have to drive 400 miles to get it. So I think there's a lot of things about the vaccination system and the kinks in the system that are working their way through.
Let's talk about herd immunity. We keep hearing this. What is herd immunity, and when would we ideally reach this?
Well, I'll give you the layman's version. Herd immunity basically means it's inherent in the word. It means if there are 10 people in a room and 8 people have been vaccinated and only 2 haven't been vaccinated, maybe either because they just haven't had the chance to do it or because they can't. For whatever reason, their physician, as Dara said, their physician has recommended, perhaps they've had severe allergic reactions, the example that Dara just gave. But there's enough people that are immunized that the vaccine can't penetrate into that herd, into that circle. And so all 10 people, by virtue of being a part of the herd, are protected. What the number is, I'll leave Dara to give the educated physician guess on that one.
Well, thank you, Susan, for just leaving all the tough questions to me. Well, first of all, herd immunity, as Susan said, generally occurs when there's enough people who are immune to the disease to make it spread unlikely. Now, and as a result, the entire community is protected. Generally, that's around 60 to 70% of the population that needs to be immune in order to achieve herd immunity. But more recently, people have used numbers as high as 90%. And as of now, I think we all know with the number of vaccinations that have happened now, we're nowhere close to where we need to be in terms of herd immunity. And to be completely transparent and honest, herd immunity to one strain of the virus does not necessarily lead to herd immunity to another strain of the virus. But that gets a little complicated. But I think, as Susan said so well, the best protection in order to get herd immunity and to prevent all of the different variants that we're reading about and seeing is for everybody to go out and get vaccinated as soon as it's your turn. Because if everyone is vaccinated against the strains that exist, it's harder for new strains to develop.
Yeah.
Let's talk about some of these variants. It seems they're coming fast and furious. There's a variant from the UK. There's a variant from South Africa. There's a variant from South America. Tell us, first of all, what they are, how the COVID mutates into a variant, and then how effective is the vaccine in keeping you safe from the variant?
Well, first, let me just say a variant is just a different version of the virus. So it means that the virus has changed its stripes in order to be more effective. And in these cases of the new strains that you're mentioning, to make them, unfortunately, more effective, and in a couple of cases, perhaps more dangerous. And we're still trying to figure it out. Our teams are currently evaluating in the lab studies about whether or not the blood components, from people who have already been immunized with the Pfizer vaccine, if those can effectively neutralize and protect against emerging variants. And the good news is that it looks like our virus is protective. We're also conducting studies to monitor the vaccine's real world effectiveness against all of the new strains. And so while the findings from the research data that we have to date do not indicate that there's a need for a new vaccine to address all of the emerging new variants, our teams, thankfully, are prepared to respond if we are able to find out that there's a new variant that seems that it won't be, effectively, managed by our current vaccine. And that's kind of the beauty of this mRNA technology, is that it's flexible, and the platform is flexible enough and well suited to allow the development of new vaccines that can be protective against the variants if necessary. But for now, the best thing to do about variants is to go and get the vaccines now that exist, because they are protective against the new variants that exist. And again, as I said before, the best way to prevent the emergence of new variants is for everyone to get the vaccine and to eliminate the variants that currently exist.
Yeah, Gwen, if I could add, I did a webinar in May for another group about the race for the vaccine and what we were doing, and that was before we were just putting the initial vaccines in clinical trials, and the vaccine, the virus was raging, and a lot of the science around viruses or virology tells you that to survive, this is what viruses do. They mutate because they can't, the door gets locked to their current version. So they change shape and they find a key to unlock the door. And a lot of people thought from the other coronaviruses that had been circulating, so SARS was a coronavirus, MERS, the Middle East Respiratory Syndrome, was a coronavirus. The history had said that, coronaviruses are pretty slow to mutate. So in May, I told a large group of people on a webinar like this, I think, we're working towards a vaccine, and hopefully we'll be able to cover the vaccine, and they mutate so slowly. I did a follow-up to the webinar about a month ago. I was totally wrong. Why was I wrong? Because the science got wrong the fact that because this virus was allowed to run rampant in so many parts of the world, and that despite the best efforts of everyone to protect themselves through public health measures, there were no vaccines. The virus just was able to run freely and mutate more so than any virologist ever expected it to. And so to Dara's point, the best way to protect ourselves from these variants, these mutated viruses, get the vaccines that are available today when it's your turn. Keep your public health measures up to date. Just because you're vaccinated doesn't mean you don't wash your hands, you don't wear a mask, and you don't take care to social distance where you need to. And to make sure that we stop the virus in its tracks. That will slow it from mutating. And so we were sort of a victim of our own inability to follow the rules that were difficult for all of us. No one likes staying at home. No one likes not seeing their family and their friends. No one liked having Thanksgiving and Christmas and New Year's Eve over Zoom. But if we did it, and if we keep at it until the bulk of the population has gotten a vaccine, we will stop these the virus from mutating so quickly. And that's what the science is telling us today.
Yeah, and if I can just pick up on something that Susan said, I mean, even after people get the vaccination, which I hope that everyone will, you still have to wear a mask and you still have to social distance. I'm hearing a lot of people say, oh, you know, I got my 2 doses of my vaccine. Now I can just run free. That's not true. And here's why. You know, there's not enough information that's currently available to say if or when, you know, it will be appropriate for people to stop wearing masks and avoiding close contact with others. And I think we just need much more time to better understand the protection that the COVID-19 vaccines provide in real world conditions before we can make that decision. And then also you have to think about, you know, the elderly, even, you know, our grandparents and our parents, those of us who are lucky enough to still have parents living, you know, some of them may have compromised immune systems. And so they may not respond as well to the vaccine and still could be susceptible to getting the virus, which is not something we ever want to do. So it's real important, even after getting both doses of the vaccine, to continue to wear a mask, to continue to keep your social distance, washing hands, avoiding poorly ventilated spaces, all of these things until we get to the other side. The great news is, I don't know if you've seen it, that there's such good news recently about the precipitous drop in the number of cases. And I think that's due in large part to everyone taking their part and doing their share of, you know, making sure that they're using the right protection and that people are getting vaccinated.
And Dara, as a grandparent, many of us are getting those 2 vaccines so we can see our grandkids. We can see family. And yes, it's hard, but that's the hope of so many people, that we can get back to some type of normal.
Absolutely. That's what we really all want. And what I'll say is, you know, I think the quickest way that we can do that is for us to get vaccinated. And again, you know, we didn't touch on it, you know, long enough in my estimation, but, you know, there is a tremendous vaccine hesitancy didn't start just with the coronavirus. I mean, you know, the flu shots. Many of our communities, Black and Brown communities, don't get flu shots. You know, and I understand that people may have challenges, but I really, if there's nothing that anyone hears that I say today, I really want you to hear me very clearly. This really is a matter of life and death. And it's yes, it's important. We all want to get back to our loved ones and to have parties and family gatherings and Thanksgivings, but we also don't want to die earlier than our time. I mean, I think there was a recent report that talked about the decrease in lifespan that we're going to see in our population based upon the coronavirus. And that I think there's a loss of 1 year for Caucasian communities, 2 for Hispanic, and 3 for African American. I don't think any of us want that.
Let's talk about that, because the hesitancy that we're seeing in minority communities, what can be said about those, you say, go talk to your doctor, where they don't trust the medical community? What do you say to someone like that who thinks, I'll get through this when the vaccine is available?
Well, you know, I think there are groups of people, and even within racial and ethnic groups, you know, it's not a monolithic, you know, group. None of the groups are monolithic. So everyone is going to have their own perspective. So I think we have to meet people where they are. And as I said in the beginning, if someone comes to me and they express a distrust, I have to first meet them where they are and understand where is it coming from. And, you know, I think we have to, you know, some of the things we know already. I mean, the healthcare system has not treated people with the dignity we deserve, historically and currently. But, what I do is I quickly pivot and talk about the benefits and risks of behaviors. And so I generally try to just kind of address people and meet them where they are, to see where they are in their concerns, and try to answer as many questions as I possibly can. But at the end of the day, taking a medicine or a vaccine or any treatment is a personal decision. My role, and as I see it, is to make sure that I have given as much informed information, as much accurate, accessible information, breaking it down in a way that makes sense, but also making sure that I am not being judgmental. But at the end of the day, it's a personal decision. I just don't want people making decisions based upon all of the inaccurate information that we're seeing in social media. So I tell people to use the sources that they trust, with hopes that they're not social media, to ask the questions that they have, to make sure that they understand the results and the end results of their actions. But after that, it's a personal decision.
Yeah, and Gwen, I can tell you that the vaccine hesitancy is not, as Dara said, it's not COVID related. It's been around for decades. It covers every vaccine, and it's not a United States phenomenon. It's an international phenomenon. It's all over the world. I have to say, the many trips I've taken and the work I've done in the developing world, when you see families that have lost children to vaccine preventable conditions, standing in line for hours to get their kids vaccinated, and you ask them, why did you come here today? Because I don't want to lose another child. Now I understand what the vaccine can do. In the United States, we don't see that as much. And I think that's somewhat of a shame, right? Because you don't have that impetus right in front of you. I mean, you have people. I have seen people at CDC meetings stand up and talk about a 12-year-old daughter that was lost to bacterial meningitis, or a young woman that gets cervical cancer because the parents decided not to get the HPV vaccine. You don't want to be judgmental. As Dara said, our role, especially her role as a medical professional, but my role as a business person, is to answer as many questions as I get, to point people towards trustworthy, reliable sources, not Dr. Google, and to let people make their own decision, but to do everything we can to encourage people to take up what I believe is a very simple step. Get vaccinated, protect yourself. You will end up protecting scores of other people without even knowing it.
And Susan, I want to go back to that beautiful story you told at the beginning of how the vaccine came to be. And while that is a miracle to me, knowing how long it takes a vaccine to get to market, a lot of people are quite skeptical about that timeline.
Right.
It's a little too fast, I've heard.
Yeah.
How can you get a vaccine that's efficient and reliable and is not going to kill me in that amount of time? So why don't you address that? So
I think the thing to remember as a company that's been in vaccines for decades, we usually do things in a very sequential way. We look at the design of the vaccine, we come up with a few different models, we test it, we learn, we pick a different model, we test it, we learn. What we knew we had to do, and what our CEO challenged our R&D team to do, was to do as many things simultaneously as we possibly could, to the point that within 1 month of putting the 4 candidates in testing simultaneously, so something we would have done 1, 2, 3, 4, we did 1, 2, 3, 4 all at the same time. At the same time we were putting those candidates into test, we were ordering hundreds of millions of glass vials, so that if we were successful, we weren't waiting on the vials to be delivered. Just one example of the kind of things we did simultaneously. We were analyzing data as we were preparing for the next phase of the trial. Usually we analyze the data, and then when we see the data, we prepare for the next phase of the trial. It's how we mitigate risk in a company, right? We mitigate risk by taking small steps sequentially. we decided we had to take greater risks, financial risks. And so we did a lot of things and pre-purchasing things and pre-planning things and getting centers ready for the next phase of the trial. And as soon as we saw the data, if it was bad, we would have stopped and we would have lost all of that pre-planning. But when it was good, we were ready to go the next day, sometimes the next afternoon. It was remarkable the speed that we moved. Now, the other thing that I like to say to people that's, I think, important, especially for those that don't understand how something that normally could take 6, 8, 10 years, how did you do it in 9, 10, 11 months, is we were working with this partner before. The platform was already under development, and we didn't cut any corners. We sped around them. So if I'm not making a play on words just to make a play on words, but to give you the image of normally we stopped at the corner, we put on our blinker, and then we turned left. Here, we sort of slowed down at the corner. We saw nobody was coming. We put on our blinker, and then we turned. Everybody's done it. We've all done it. And if there's a policeman and you want to give me a ticket, okay. But I believe what we did was in the interest of global public health, and we did it at the speed of science. So we let the science guide the speed, and we took a lot of risks that had it not happened, the company would still be standing, and we would have known we tried really hard. But I have to say, Dara and I are both really thrilled to say that we succeeded.
Oh, yeah. And if I could just add to what Susan said so eloquently, in addition to our own internal actions, all of our clinical trials are monitored very closely by and independently reviewed by regulatory authorities. And our protocols, the steps that we take in our clinical trials are reviewed by what is called institution review boards. And the role of the institution review boards really is to ensure that the study participants are not exposed to unnecessary risks. So we're monitored by external committees. One group you may have heard about is a data monitoring committee. And again, as Susan said, I mean, they would have had us stop the trial, and certainly we would have stopped the trial if we were to find that either of our vaccine candidates didn't work or if they harmed participants. That's part of our normal day-to-day work. And then in addition to that, the clinical trial investigators at the various different sites, they have to follow up and monitor all of the study participants to make sure that they're not having any bad reactions. And we track this for, all throughout the trial. And we'll be tracking this information for at least the next 2 years following the second dose. So it's important to make it clear that not only do we have strict safety protocols internally, we're also watched very closely externally.
And ladies, have either of you received the vaccine?
Gara?
Yes, I have. I've received both doses.
I have not. I am not yet eligible, but I hope I will be soon.
So you're not only confident, Dara, you have taken the shot in the arm.
I absolutely have, because I'm a firm believer is your words are important, but your actions really speak very loudly. And I would not, put myself on the line talking to audiences across the nation, as I am currently doing, without making sure that I am doing what I am actually asking and everyone else to do, and that is to take the vaccination. It certainly, hopefully, will be just one step, and the one thing that I can do to get us closer to, getting back to the time where we can enjoy our families and enjoy our lives and be healthy.
All righty, ladies, don't go anywhere. We're going to start taking questions from those who have tuned in to this Armchair chat. So if there are questions, we'll have them placed on the screen. Okay, so our first one, as medical professionals, would you recommend getting the vaccine before starting fertility treatments? And is it safe for pregnancy?
Yeah, I'm going to just go back to my standard answer on that one. That in particular is such a nuanced question. It has to be discussed with your physician. We don't have any information to impart on that. It is something that must be discussed with your physician.
Jenna, thank you for that question. Our next question. I've received my second dose of the vaccine with very little side effects except arm soreness. 8 to 10 months down the road, should I be getting an antibody test to see if I have antibodies?
Wow, that's a really great question. You know, I don't think that any firm recommendations about that have been made. So my response to that would be stay tuned. Certainly, I think as we learn more about the protection that we see in the people who were in the clinical trial, who now, you know, many have had their second dose, and they are now evaluating them for antibodies. I think we'll learn more, and I would expect that there would be recommendations based upon how we see that people who have had their second vaccination and how the antibody levels decrease over time as to whether or not you would need to get an antibody level to detect your level of antibodies. But that's a great question.
And thank you, Dee Livingston Hodges, for that question. And I guess a question just to follow up on that. Talk about some of the side effects. I've heard about the sore arm. Are you running a fever? Are you a little woozy afterwards? Is that why they're asking you to sit there 15 minutes? Just talk a little bit about that.
Yeah, so I think what the you know, evidence, the real world evidence has shown, and also evidence from the clinical trial has shown that, you know, the first dose people have, you know, a limited response. You know, it could be sore arm. You know, some could have pain, some could have chills, but most people are reporting that after the second dose, you have much more of a reaction. But again, it's important to note that everybody's system is different. Everybody responds differently. And, you know, you can't say, oh, well, I had a robust response, and so that means the virus is working, or I didn't have a response, the virus is not working. I mean, our human bodies are so complex. We respond differently, but some of the common side effects that people have reported are chills, shaking chills like you have flu-like symptoms, headache, arm pain, of course, has been common. So those are some of the common, and fever as well. And those are some of the common symptoms that people have reported after the second vaccination in particular.
Alrighty, our next question. What are examples of the virus mutations and how one changes would be made in the vaccine itself based on the virus mutations?
So I can maybe go back to my 3D printer analogy from I think we talked a little bit about the mutations and the strains, but if you think about, if you want a 3D printer to stop printing a truck and you want it to print a bicycle, you have to change the code. The question is, the truck can still be a great toy, and if you can get your grandchild to play with the truck, why do you need to print a bicycle? What we're trying to figure out, and I think Dara explained it, is how robust the immune response is in individuals with some of these strains, where we've looked at it and we seem to have good enough data today in the lab that says our vaccine is still effective. So I don't need to recode the printer. We're continuing to study it because the mutations will continue to come up. And we may eventually look at a new code. So we'd need a slightly different vaccine, or perhaps the bicycle in addition to the truck. So sorry for the analogy, but I think I want it to sound fairly, the great part about this technology is that it is fluid, and we can reprogram it once we know the genetic code of the new strains. But right now, the data doesn't tell us that we need to do it urgently.
All righty. Thank you, Valerie, for that question. Our next. Is this vaccine good for a lifetime, or are regular immunizations, vaccines required? Is it like the flu shot? Do I have to get it every year?
Yeah, the real honest answer is we just don't know yet. You know, as I mentioned before, there will be evaluations of antibody levels over time and how they change. And I think based upon the information we learn over time, a decision will be made whether or not you need to get.
Sorry, that's my ferocious dog. I apologize.
Yeah, wow. I was going to say the dog didn't like my answer.
No, she loves your answer.
But let me just say that I think, that decision is going to be made over time. And, as it stands right now, we just don't know how frequently someone will need to get the vaccine. But a lot of it depends upon, your own immune response. It depends on the level of what we call circulating antibodies in your system. It also depends upon, the virus and how it changes or the number of variants that are out there. So the short answer to your question is we don't yet know. But certainly that is one of the questions that we'll be wanting to answer based upon information we find as we follow research participants over time.
And what is the next step? The vaccine is out there, it's going in arms. What's the next step?
Well, I mean, in terms of the next step, I mean, as I mentioned, our teams are continuing to monitor everyone who was a part of our clinical trial for a period of 2 years. But there are many research studies that are happening right now. I mentioned one on pregnant women. I know our team is also looking at, ways to figure out how we can figure out how to vaccinate younger children, right? Because right now our vaccine is only approved for emergency use authorization for people age 16 and older. I think, and Susan, maybe you can speak to this, but I think our team ultimately is going to get beyond the emergency use approval period to a full licensing for the vaccine as well. But in the interim, there are many studies that are happening both at Pfizer and at many places to really assess and learn more about the virus as well as the vaccine.
And Susan?
Yeah, and I think, one of the key things is it's inherent in Stephanie's question, which is how long is it good for? We know we have to get a flu shot every year, but we have to get a flu shot every year because we know the flu virus really does change. And so the flu shot from last year probably isn't going to work this year. We don't know that enough yet about the coronavirus, Stephanie. So we're trying to do that research while, as Dara said, while we follow the subjects that were in our original trial to get the long-term data that we didn't have, that we got emergency use authorization just because of the truly deadly nature of the virus. So stay tuned. Certainly this data is as public as any data we've ever had. And I'm sure as the data emerges, it will continue to be made public.
Alrighty, thank you. Our next question. Okay, this is from the Cultured Pearl Foundation, which is sponsoring this little armchair chat. It has been said that Black people are dying at twice the rate as Caucasians. It's also being said that Black and brown people have less trust of the medical community, primarily based on the history of medicine using us as guinea pigs. In fact, worse than guinea pigs. I believe the relationship is not as linear as this hypothesis. Any thoughts on alternative theories or other factors that account for this disparity, such as being uninsured, being treated as less than because of insurance, not having insurance, your skin color, your sex? Any thoughts on accounting for these disparities in the healthcare system?
Yeah, no, this is something that I speak about regularly, and I mentioned earlier in my remarks. I think vaccine hesitancy needs to be contextualized. The reality is the healthcare system has just not treated people of color with the trust, with the respect and dignity that we deserve. And I talked about the historic transgressions, but I also, such as, all of the research that had been done where people of color were harmed. I mentioned Tuskegee, Henrietta Lacks, there's Guatemala syphilis experience, there's a Havasupai tribe experience. But then I also, spoke a little bit about what our current barriers to accessing healthcare. And I agree that those are ever present, irrespective of socioeconomic status. And let's just face it, there's clear institutional and systemic racism. There's implicit bias. And again, microaggressions or macroaggressions. I mean, there have been studies that have spoken about, people of color not receiving pain medications because of stigma and assumptions that they're going to abuse the medications. There have been incidences where they were ignoring the symptoms of anxiety or heart disease when people of color present. A woman of color presents with, symptoms of chest pain, and people say, it's anxiety or she has a mental health condition, when in fact she may have, coronary artery disease or be having a heart attack. There's delayed treatments in cancer. So there's a lot of things, and let's not even think about maternal mortality rates for women of color. So all of these things taken together have left this legacy of mistrust that does affect the willingness of people of color to participate in research, to take medications, or even to receive vaccinations, which is what we're talking about today. But I think what we have to do is work overtime, in particular in this instance, to help people understand that this is one where we cannot stand on the sidelines. I mean, I'm not discounting all of the egregious acts that have happened to people who are in Black and brown communities. But as I said earlier, I wouldn't have taken the vaccine if I didn't feel that it were safe or effective, or if the risk-benefit profile didn't match up. And also, I think it's important to say, we have, as people of color, given the systemic and institutional racism, there are many other systems that are problematic. But for some reason, we figure out a way to maneuver within those systems. So I think we need to do the same thing, in particular with the healthcare system, particularly when it's to our benefit. And particularly when we're seeing Black and brown bodies in those body bags far more often than we're seeing Caucasian bodies. And any death is an unnecessary death, particularly if it's something that a vaccine could eliminate. But I think in this instance, we have to figure out how can we leverage this point in time in our history as a turning point, as an inflection point. In the way that we interact with our nation's healthcare system. Make sure we get the facts, make sure we leverage our trusted sources, but make sure we do what's in our best interest, given the information that we have. And right now, the preponderance of information is telling all of us that it's time to get vaccinated.
Yeah. And all I can say is I can echo the outrage. I can echo Dara's comments. And I can ask all of you to help turn the tide. It is time. It is a pivot moment. The world's attention is on whether we as a collective community, not a Black community, a white community, a brown community, but as a collective community can beat this virus. And the transgressions of the past are horrifying, and they're probably way more than any of us know about. But if we can take this moment to stand up, each and every one of us, for what's right and get people the information they need to make the decision to be vaccinated, it will be the turning point for this country in the disparities in medical treatment, just this COVID-19 vaccine situation. So I'd urge all of you to seek the medical advice that Dara recommends. Don't take it from us, from a fireside chat. Take it from your trusted advisors and your doctors. But if there's information that anybody can help you get, go get and get vaccinated.
All right, ladies, that was our final question. Sincere thanks to both of you for sharing your time and your expertise. I hope it has assured many who were a part of the fireside chat to go get a vaccination. And at this time, we're going to turn it over to Lisa Bennett, the president of the Alpha Kappa Alpha chapter. Thank you.
Thank you, Gwen. Lisa, you're on mute.
Of course I am, because I was working in the background.
want to thank you all so much. This has been a tremendous program for our community. Gwen, you always answer the call when we need a wonderful moderator, very thoughtful and informed, and to guide that conversation. So thank you first. Dara, we thank you for the medical expertise. I think that it's so critical to have people of color, and especially a woman of color who looks like us, to communicate that message, what that means to our community. So thank you first for serving our community and being that advocate. It really does mean a lot to us, and it's such a critical role. So thank you. And Susan, thank you for leading the COVID team and then transitioning into this other leadership role. Again, it's a woman. We know that if we educate women, we educate the world. So you both are so critical to making a difference. We lead those families. We take those children to the clinics to get the shots, and we make our husbands get the shots as well. So we thank you so much for your service, because this is a service, and thank you for taking a Saturday afternoon, midday, to spend it with us, to share this information. To all of our guests who have joined us, this program will be on our Facebook page. I encourage you to go back if you missed a question, if you missed a point, to listen again. I also encourage you to share it, because it's out there and it will be there. You can say, this is what I learned from an informed and reliable source. So please share that information. I want to thank the Cultural Pearl Foundation, who has joined with us to host this program. Your vision and insight has been tremendous. I don't know if Jen's available, but to join me on camera just to say thank you to her and for her leadership and for her team. So I am taking all of the information. You all have been amazing. Thank you to the board of the Cultural Pearl Foundation for all of your hard work and time. And you put in very thoughtful, amazing, and have a wonderful afternoon. And we can't thank you enough.
It's our pleasure. Thank you.
Our pleasure. Thank you all. Stay safe.
Thank you.